I'm Kevin Wade. I'm one of the senior therapists here at the St. John Clark Pain Treatment Center, and I'm here to talk to you today about migraines. If some of you have been following our videos, my colleague Randy Clark posted one last week talking about a new program that we're starting in relation to pediatric migraines. We've done a little bit of research. We've seen these cases in our clinic already, but we kind of looked a little bit farther into it. And the statistics and the research are kind of shocking as far as it goes related to kids and pain and migraines in particular. The research we were looking at was saying that 75% of children experience headache pain by the time they're 15. And about a little bit more than 5% of those kids experience chronic migraines. Now, if you take the whole United States and the demographic of 0 to 14 years old, it comes out to be about 460,000 children in the United States that suffer from chronic migraines. We think that's way too many, and we know some ways that we can really help with that. So we wanted to offer this program to parents who have kids who suffer from headaches, migraines in particular, to come in for 4 treatments. And if your child isn't significantly better after those 4 treatments, we're going to give you your money back. We're really confident in our ability to treat migraines, and we want to offer this to help kids out. We think that if we intervene early in their life with a chronic pain issue, that we're going to make big changes for them, and they won't have to deal with that chronic pain through decades of suffering with migraines. So I wanted to start off by explaining about kind of migraines in general and how they work and what then we do to correct for them. Migraines are really a vascular issue, meaning it's about blood pressure. That's why most of the medications that are given to treat migraines are vascular drugs. They're vasoconstrictors, actually, and I'll tell you why that's important in just a minute. Part of our issue with trying to help treat children is that, we all know that the medications come along with side effects, right? And we prefer not to see kids having to take those medications for long periods of time and develop side effects early in their life. We've got all the vasoconstrictor medications. Medications that are given to try to prevent migraines are things like anti-seizure drugs. We've got some antidepressants, we've got some antihistamines, we've got some beta blockers. These things are given to kids to try to help prevent their migraines with some success, but like we said, along with that comes the side effects. With neurosomatic therapy, we use no drugs. There's no surgery. There's nothing invasive involved with neurosomatic therapy at all. We're working with the soft tissues, the musculature that is involved in creating postural distortion, taking the skeletal system and moving it into positions that are inefficient, that cause pressure in joints, that cause pain, and in this case, for migraines, actually interfere with the blood flow coming out of the cranium. So a migraine typically starts with blood being pumped up into the cranium through the carotid artery, those structures to get blood into the cranium. Very important for us to continue to have blood into our head. So the body has arteries that do that, and they're very well protected, and there's not much that will stop that blood from going into the cranium. However, when we drain blood out of the cranium, we're using veins. All right, and the veins are a little less rigid. They don't have much muscle in them, and they can become easily compressed. So there's a couple of structures that we need to understand. There is the jugular vein and the vertebral venous plexus. So I'm going to show you a diagram with these structures in it. Let's go over to this chart. This is a picture of a typical cervical vertebra, okay? And down here, we can see this foramen in the transverse process, and within that little opening is an artery, and the vertebral artery, and the vertebral veins. There's 3 of them in there, okay? Also, we have here the vertebral venous plexus all along the back of the spinal canal there. There's some of it up next to the vertebral body there as well. Those are all smaller veins that allow blood to drain out of the cranium. These vertebral plexus veins actually come down and they hook into the vertebral veins right here. Now, the other big outlet for blood in the cranium is the jugular vein. And I just want to point out right here, this is the jugular foramen right here. It's a space between the occipital bone and this little wing of the temporal bones right there. That'll become important in a moment. Typically, this is how venous return out of the cranium works. When we're upright, when we're opposing gravity, the jugular veins actually close down when we're upright. So that prevents too much blood from leaving the cranium all at one time, all right? So we kind of control the flow out. The vertebral venous plexus takes over, it drains blood out down through the cranium into these vertebral arteries. When we lie down, however, the body needs more help getting blood out of the cranium, and so we use the jugular veins as well. They open up, and blood is now draining through the vertebral venous plexus and the jugular veins, all right? So that's kind of how it works normally. What we find, again, is what we said is the pressure builds up in the cranium when there's too much blood going in and not enough blood coming out. So how does that happen? When we're upright, we can have distortions of the C1 and C2 vertebra, all right? I'm going to use this model here and kind of demonstrate. This elastic right here is actually going through the vertebral foramen. You can see how it passes through several vertebrae. The rest of the cervical, it contains those veins and that artery as well. And that all heads up into the cranium. And that the vertebral plexus is kind of inhabiting this space back here, and draining into those vertebral arteries. So what we see as distortions that are pretty classic for headache sufferers are rotation of the C1 in one direction and a rotation of the C2 in an opposite direction. That puts a twist into those structures. If you look at the elastic band here, when that rotates forward on the right here with the C1 and backward on the C2, that puts a real tension into those structures that are going through the vertebral foramen. That can cause occlusion or pinching off of those vertebral arteries, okay, or the vertebral vein. Now, that's one mechanism where the blood is limited in kind of leaving the cranium. Remember, these vertebral veins are draining into the vertebral, the vertebral plexus veins are draining into the vertebral veins out in the side of the vertebra there. So we get that twisting and that tension on those veins and occlude them, cut them off, prevents blood from draining out of the head. What we also see is when this space in here, inside the spinal column, is twisted in opposite directions, that can occlude the vertebral venous plexus as well, puts a tension in twisting that structure. So now both of the mechanisms for blood getting out of the cranium are limited by that distortion of C1 and C2. Right? Remember, the jugular vein's not working when we're standing up, so that's the only way out for the blood to go. Now, most people find when they have a migraine, what's the first thing you want to do? Lie down, okay? For a lot of people that helps, because then the jugular vein opens up and the body has the ability to move the blood out of the cranium and reduce the pressure and start to normalize the headache. But how about if these two little holes back here, where the jugular vein comes out of the cranium, what if those are occluded? We use the term stenosis. Stenosis is a term for a closing off of any open space that should be have room in it, and it can apply to a lot of different places in the body. But this stenosis at this jugular foramen can close off the internal jugular vein route there as well. And then that patient has problems with migraines, and they don't even get relief when they lie down. They're in pain standing, they're in pain lying down. There's not a whole lot that helps those folks in terms of trying to soothe themselves from a migraine. How does that happen? When we get stenosis here at the the jugular foramen. Well, this is our chart. We can measure the position of the cranial bones. A lot of people don't know that the cranial bones can shift and move and become distorted just like any other joints in the body. And there's a couple of different examples of how that happens. The occipital bone here is represented by this first line. That can move up towards the top of the head, and the temporal bone can move down towards the occipital bone and create a compression at that jugular foramen there. When the cranium is distorted in a front to back kind of way, if the temporal bone is moving backwards up against the occiput, that space can be diminished there. So it reduces the ability to move blood out of the cranium through the jugular vein, even when the patient with headaches is lying down. So what do? We, in neurosomatic therapy, take a full postural analysis. This chart kind of represents all of the measurements that we take. We can tell when the cranium is distorted. We can measure when the atlas and the axis is distorted, and generally what is the cause of that. Often the causes of those distortions are represented by distortions elsewhere in the body, even down into the pelvis, down through the feet. We look at the body as one functional unit. So when we're trying to correct these issues in the cranium and the atlas and the axis, we look at correcting the whole body. But the focus of the treatments for migraines are at the cranium and at the atlas axis, and looking for any reasons why they might be distorted in the first place. We would correct these structures for any migraine suffering patient, whether they're adult or pediatric. But I wanted to kind of point out the fact and why we're so excited to treat kids in this situation is that when we get young people in the clinic, they have not had to suffer these postural distortions for decades in their life. Young people are very pliable, they're very flexible, they're very changeable. So we find that we can take those kids and do this postural correction and get really powerful results in a short period of time because of how malleable children are. That's what's so exciting to us when we have kids come into the clinic. We're not happy to see that they've got pain and they've got dysfunction, but we are happy to work with them early in their life because we can make these changes so that their experience at school is better. Their experience of enjoying time with their friends and their family is better. They're not laid up in bed with a headache, not being able to live the life that they should be living as a vibrant child. That's what makes it so exciting for us to be able to work with kids and help them to make these changes early in their life. Again, we'd like to invite you parents who are seeing this video to take a look at our website. We've got a page up about pediatric migraine there. We'd be happy to discuss with you the options and the prospects of treating your child and helping them with their migraine pain. All you need to do is give us a call at the clinic, and we'll work on this for you and your children. I think it's really, truly life-changing for those young people. So thank you for taking the time to listen to this video today and see what we have to offer as far as migraines go. Give us a call at the clinic if you'd like more information. Thank you.